In the studios with us. Good morning, good doctor.
Good morning, Jerry. How are you doing?
As always, that's my life.
Good.
Yeah, that's what you saw this morning. I hope you're well.
I am very well. And how are you two this morning?
Running up and down every morning. That's what happens. Mental health, what is it?
Well, I mean, whenever we talk of mental health, it looks as if a lot of people are afraid.
Yeah.
But I'm happy I'm sitting in front of you and you are not afraid.
No, I didn't say I wasn't afraid.
I am sure.
Yes.
By asking me the first question leading to the next, I'm confident you are not afraid. Now, mental health, as humans, we all have mental health.
Okay.
And so in Ghana, if you have over 32 million Ghanaians, we all individually have mental health. And by mental health, my ability to think, my ability to feel, my ability to behave in a way that supports how I want to live, that constitutes mental health.
Oh, okay.
And so if you are an individual, are you able to think about matters? Are you able to feel a particular way? Are you able to behave a particular way? So that is the triangle we need to keep in mind.
Think,
whenever
feel,
and behave. So it's a triangle, and every human must go through this triangle. So long as you can go through this triangle and support how you want to live, how you want to function, then we say you have mental health. Now, mental health could be good. It could also be poor. So at this point, because we are teaching, you can think of when we were young, drawing a number line. If you draw a number line, there are two arrows, one pointing to the left, one pointing to the right. In the middle, often what number do we have?
0.
So let's put the 0 there. Now the 0 there is all of us humans. And so our mental health is at the point of 0. We all have it. Now, to the positive, our mental health could be positive depending on the support that we give our mental health. The kinds of things we do to support developing that positive mental health or the good mental health. In that case, we move from 0, begin to move to +1,
1, plus
2, plus 3, and it keeps going. It
infinity.
means we can feed it so that we will consistently have that positive what? Mental health. On the other hand, our mental health can be negative. In that case, we move the opposite direction. So how we normally think, how we normally behave, how we normally feel, perhaps it is affected in one way or the other. So I move toward the negative. Now, this is where I need to explain. All of us humans, at some point in our lives, navigate between moving into the negative and then coming back to the 0 and moving into the positive. It happens to all of us. So what have we said so far?
Doc, are you saying that at one point or the other, every one of us would have gone negative in terms of mental health,
yes,
and come back to a 0 and then maybe go back to a positive?
Let me put it this way. As an adult Ghanaian, we all at one point in time have had a negative or a poor mental health and a good mental health.
Doc, let me come back again. As an adult Ghanaian,
yes,
all of us at one time or the other have had mental problems and we have come back to normal.
Okay, so I want to build up my explanation. Now we are talking about mental health.
Okay.
And I will differentiate it from mental illness or mental disorders. What many of us think mental problems. So I want to differentiate it. So the point I'm making is we all have mental health as humans.
That's a 0.
That is the point. In our mental health, we can grow it positive direction of the number line. And our mental health could also be negative. That is the negative direction of the number line, that continuum. Now, how do we develop that negative mental health?
That is where I'm interested.
So, question, Jerry, have you lost a loved one before?
Of course.
How did you feel?
Terrible.
Terrible. Is it possible for a day or two you felt like not eating?
Of course.
So you see, a number of thoughts may have crossed your mind. So at this point, we mentioned we all have mental health in that we think, we feel, we behave.
Okay.
You realize that you begin to think, how can he die? What has he done wrong? We were here together yesterday. You keep reflecting. Your thinking is now getting affected. And this affects how you feel, even about life in general. Then this begins to affect how you behave, your eating pattern. At this point, if you were at 0, which is the normal state of mental health, you are moving toward the direction of negative.
-1.
You may not have eaten for a day or two. You feel like going nowhere. You feel like being alone, being quiet. At that moment, your mental health has moved from seemingly good or neutral position to a negative position. If you stay there momentarily because of the events, because of the sad thing that has happened to you, being hit, being rocked because of an incident, that may be normal. And we all go through that. I fail an exam as a student. I feel sad if I look at the effort I put in and I feel like giving up. You move toward the direction of the negative. Students go through this. In marriage, people feel disappointed out of one issue or the other, and it begins to affect how they are thinking about even they themselves and how they feel about their partners and how they may want to behave. It moves away from ordinarily how they would have done.
So broken heart could send you into the negative side of the mental health.
Exactly, because we have a number of cases. So the point we are making is we all humans have mental health. So the next time we hear mental health, we don't want to have some pictures in mind because we all have it. So that is the first clarification. Now at this point, I know you are yearning to hear what then is mental illness or mental disorders, what many of you call mental problems.
Yes.
Now, given the explanation of the number line, I move to the negative. Now, I move to the negative because I lost a loved one. I am not eating. I want to be alone. If it is the first few days and the person begins to come back to the 0, that is normal. But this one, consistently, the person is alone. The person is not eating well, not taking care of his body well, simply because of what just happened. Then it's deepening. So if it was in -1, as the day goes by, as the weeks goes by, it is moving to -2, -3, -4. It keeps going. Then consistently, we are experiencing a very difficult recovery. And the person stays there for a consistent period of time, a reasonable period of time. If a diagnosing mental health professional realizes that no, this is not okay, and consistently is showing up, it is up to the diagnosing mental health practitioner now begin to suspect that indeed you are developing mental illness or disorder. So that is a consistency of that negative thinking, feeling, and behavior, such that your thinking, your feeling, and behavior is no longer within the parameters of what the average human does. At that point, then we suspect you are developing mental illness or mental disorders, of which we have different categories or types that we can discuss as the time moves on.
So on a daily basis, what are some of the things that as an individual I can do to ensure that at most if I don't go to the plus, I'll still stay on my 0. Or even if I go into the negative, I don't even get to -1, I'll come back to my 0. What are the practical strategies that we can use to take care of our mental health on a daily basis?
A number of things that we all can do. I will summarize it by talking about 3 things. The foremost one is self-care. The second one is support. And in extreme cases where people develop mental illness or mental disorders, what many refer to as mental problems, or when you realize, no, my thinking, my feeling, my behavior is not the way it is. Or if I'm listening to Z Media and now I'm beginning to understand that, look, the behavior pattern, the feeling pattern, and the thinking pattern of this my family member. I am a teacher, this my student. I am an HR manager, I'm a manager, supervisor, this my worker. I am the manager for this particular media house, this my reporter, this my journalist. After reporting on this particular death news and accident, the person is not thinking, feeling, and behaving well. Then I can take steps. In this situation, and then you are overly affected, treatment also comes in. So I have mentioned 3 key things.
Self-care, support, and in extreme cases, treatment.
These are the 3 key things that I will want to highlight.
Let's touch on self-care.
Yes.
When you say self-care, what do I do?
Your question was about practical ways we can ensure that we continue moving from the zero state of our mental health and keep increasing and making it more positive. Now, let me say that when we talk of self-care, the me factor, I also matter. Just that simple question that every individual need to ask.
I also matter.
I also matter. Sometimes we care so much about others, but we fail to prioritize ourselves. There are a number of things individually. As at now, I don't know where you are seated listening to Z Media. Whether you are driving, whether you are seated under a tree, whether you are working, whether you are in your office, wherever you are, the me factor, I also matter, reflect your readiness to adopt strategies that will promote your own self-care. And what are some of the things that we can do? When was the last time, Jerry, you pampered yourself?
Hey, pampered.
When was the last time you took a backstage to reflect, how am I doing? When was the last time you took a stock about your daily routines and whether it's having any impact on you, your health, as well as your relationship with others? As families, when was the last time we created time for ourselves? I remember I visited a particular hospital and I noted for the 2 hours I stayed there was a young boy, about 8-9 years. The boy was holding a tablet. For the 2 hours I was there, this little boy had lost the environment around him. It was all the tablet. At a point, he would lie on the small couch, tilt the tablet in a sleeping position still on the tablet. He will sit. He changed positions 8 times. 2 hours still on the tablet. Technology can even take away the me factor, even in families. So as families, when was the last time we created time for ourselves to just take a break, reflect on nature, rest our body so that we can recharge our batteries? By self-care, it's not about how rich or poor I am, but that's what I call strategic intentionality, that I matter in promoting my own health. That is what self-care means. What you do to promote your self-care may not require money. It may require proper planning. It may require giving yourself attention. It may require letting certain things go so you'll be able to care well for yourself.
Wow.
There are countless examples, if time will allow, we can cite regarding self-care. For instance, Jerry, when was the last time you decided to have shiatsu, Japanese massage?
Never had it before.
Never had it before. Mrs., you've heard it. So that is a very simple thing that you can do. I remember engaging some colleagues, and I mentioned even having a very long bath, warm bath, also contributes to your well-being. And that could also be part of the self-care. We are so busy that I am leaving in 5 minutes' time, and the mom or dad is now going to the bathroom. Within 5 minutes, you finish bathing. Even when it comes to simple things like bathing, that also support our health and well-being, we rush through it. So how would you have that long, warm bath? I said this and somebody said, not when you live in Ashalibuchi, simply because you don't even have the water and you are thinking of a long and a warm bath, you know. But the point is, these are things that are readily available at our disposal. I am sure at another opportunity we can decide to talk about, say, just sleep. We can engage for about an hour or two just on sleep, and how even sleep is the best medicine and one of the finest self-care we all can have in order to promote a positive mental health. For instance, many of us have heard that they say we need an average of 6 to 8 hours of sleep. And let me put on record, the 6 to 8 hours of sleep is not about intermittent sleeping. I've slept 2 hours in the morning, I slept 2 hours in the afternoon. No. The sleep cycles, we have 4 phases of sleep. Each phase takes about 90 minutes. So 9 times 4 gives you what?
Hey, this thing you're saying, you're talking to me personally.
Well.
That's 36.
Yes. And so if you look at 36, 90 minutes, now we have 60 minutes in each hour. And that gives you that average of 6 to 8. Now, this is what is in it. If you do not get a complete cycle for each of the 4, the worn out tissues in your body, as we get up, we lift a hand. I am talking, my jaws are moving, my esophagus, the pharynx, all of them are moving together. And that is what is generating this sound. And then whoever is watching us or listening to us can hear us. The tissues in my body are getting tired. They are getting worn out. Sleep is the opportunity for all these worn out, tired, let me put it in this way, injured tissues within the 4 phases of each cycle, 90 minutes. That is the only opportunity all the worn out tissues will repair themselves so that by the next day, you are optimally ready for another day's activity. And so just sleep. And so if Jerry decides that, no, instead of 6-8 hours, I'll keep it to 4. It means day 1, you have 2 hours arrears. Day 2, 2 hours arrears. If this continues, your worn out tissues have arrears. If you have a good body, you begin to fall sick, you go to the hospital and the doctor says, lie down 3 days. Sometimes it's not the medication they give you or the injection alone that makes you feel well. Some of the injections put you to sleep. And by getting that quality sleep, the body will now begin to finish repairing all the arrears and you get better. In some cases, if your body is not friendly, you have underlying health conditions and others, it can kick you and attack you in the form of a heart attack or anything, And then perhaps you may not be able to survive because the worn out tissues are too many that your body is no longer responding.
Doc, you would have to come back for us to have a discussion only on sleep, because this one you're talking to me personally, and it's touching me, because I don't think I do even 4 hours. I think the most I'm doing is like 3.5. We're talking to Dr. Collins Badu Agyemang, who is the president of the Ghana Psychological Association. It's just a few minutes past 9:30, and we want to also go into stress.
All right.
Stress management. How does stress cause to mental health challenges, and how can we manage stress effectively?
All right. So, Jerry, I hope you are noting all the questions. We only discuss small about self-care.
Yes, we've not even gone to support.
We've not gone to treatment. But, I mean, I'm sure as a starting point in having a conversation on mental health.
Next week you should come.
All right, let's see how it goes. Yeah, so stress is one of the common mental health challenges that all of us go through. From young children to adolescents, early adults, older adults, and the senior citizens, we all go through stress. Now, what is stress? Simply put, when our resources are way below the demands on us, then there is a stressful situation. This is the simplest way I can put it. Whenever our resources are far below the demands, and most of the demands, we may see them as very important, very urgent, they are must-do demands, then we are in a stressful situation. Let me cite a practical example. I am a police officer. I am a sergeant. My salary is 2 cedis. I have 3 children. I want all these 3 children to go to school A and B, who charges in dollars. And per the dollar amount, one child's fee alone is the 2 cedis I take as a monthly salary. And I have 3, meaning I have a deficit of 4 cedis. What you yourself as a father, your wife, if you have aged parents, your bills, all of these, you have a vehicle, fuel have not come. What are you doing? Your resources are far less than the demands on you. You will always be stressed. Let me talk about I am a teacher. And as a teacher, I am a principal superintendent. My salary, everyone knows. And I want to build a house for myself, for my future. What kind of house? 5-bedroom house, each with toilet and bath. And I ask people, is it a guest house? The stress you will go through because your resources are far below the demands on you. You may never finish. And if you want to finish, then we should understand why we have corruption in Ghana. So when the resources of people are far below the demands, some of the demands are self-imposed, such that we want to be who we are not. And I think that is one of the things that we need to look at. There are some level of stresses that we all go through because we are engaged in one way or the other. If you are working in the banking sector, and I pity all my friends and my dear ones who work in the financial sector, given where we find ourselves for the past few years, a very small market, we've had turbulent times, and a number of commercial banks operating within the same small space. And managers, I remember one of my friend MDs, he will always say, we need to keep accelerating. Dr. Agyemang, we need to keep accelerating. Every bank would have to keep accelerating. We need a deficit, we need a deposit, we need a deficit. Now, we need a deficit, challenges every staff to meet a particular target. And the target meeting is not easy. The metrics are always open. Maybe every Monday to check your performance the previous week. If it is not open every Monday, in the banking sector, they call it the war engagement. War means weekly activity report. And the engagement meeting is like war. And so many bankers do not like Mondays. If it is monthly performance review, it is a day no financial sector worker likes. These things present challenges.
I'm beginning to suspect that Mr. Alex Mensah set me up on this very interview because I did 10 years in banking. I'm sure Mr. Alex Mensah has a hand behind this because it's like talking to me here as well. You don't want to miss those meetings.
Yes.
Secondly, in such meeting, because your colleagues are also there, that's where the stress is. Which is why if it's a MAR, you are calling your colleagues the week before and literally begging, Charlie, don't you have some 100,000 that I can put in there?
Exactly. And that is how the situation is. We can't talk about the varying nature of stresses on different gender. So if I am an SME banker, if I am a marketer for that bank and I'm a female, the clock is ticking. I have 2 days, I must get this amount, otherwise I'm doomed. What kinds of engagement activities do some of these staffs engage in? So in talking about stress, we all go through stress in one way or the other. Parents are going through stress. If you live in, say, Oibi, Kaswa, traffic alone, I have a particular presentation when I do, I caption it Ghana-based stresses. And a number of them I list. These are context-specific stresses. And one of them is traffic. You need to move from Kaswa Opekuma to Accra to work. When do you leave?
4 o'clock.
If you have children, what time do these children get up?
Like 3:30.
3:30. Can you imagine the recent challenges we had on the Kaswa Road? If your children are schooling in Accra, what time did they get home?
Like 2 a.m.
So the mental health of children begin to be affected. Go to countries like Finland and co. They are known to be the best in terms of benchmarks of education. How many hours do they spend? Do they write a so-called exam where the first worry? They don't do these things. And so children who are schooling are going through stress. We are in East Legon area, and you see the number of schools, and every morning parents are driving like mad ones chasing nothing. All because of the self-created stress that we build around ourselves. I have always told my children's teachers, they will say, Doc, you've not picked your children's reports. And I don't rush in going to pick my children's report because what I'm interested in is not your so-called first, second, 90% or no. I'm interested in what you write under. The behavior pattern of my child. If I failed there, I have failed. Because I know once I get that one right, forget about the figures. They will be responsible adults in their own rights.
Hey, Doc. Yeah, it's an interesting discussion so far. The second thing after self-care is support.
Yes.
What do you mean by support, and how does it affect our ability to manage our mental health?
All right. So by support, we all need relevant others. And that is all I mean. So we need to appreciate people. If you look at one Harvard research that was done for over 70 years, it's a longitudinal study, meaning a study that was done across
a long period
of time. And the conclusion was we need people, relationships, to be able to stay happier as we age. So please, I don't know who this building is for. The person may be rich. I don't know who this business is for. The person may be okay financially, but how much money you have does not breed support or impact on your overall mental health. So what we are trying to say is that we need people, we need quality relationship. we should be able to connect with relevant others. And there are several ways we can have this particular connection. And I think overall in Africa, we are not doing bad. But the challenge in Africa as far as support and relationship is concerned is the quality. It looks as if over time, because of the pressing demands, especially those in urban centers, the quality of our support and relationship is diminishing. So at the church, it is an avenue for quality relationship and support. At home, where we live, the neighborhood. Unfortunately, elsewhere in other more advanced countries, someone can die in his or her apartment for years and no one will ever know. And are we getting there? I had a friend who visited me in Ghana, and driving through East Legon to my house, he said, Collins, it looks as if Ghana, you have a lot of prisons. What are the prisons he's talking about? The walls are so tall, with barbed wires, electric fencing, and you see the signage security, and he thought these are prisons.
Oh, okay.
So it looks as if, even though in Africa we try as much as far as support for one another, building quality relationship is concerned, gradually is diminishing simply because of our more or less inclination to adopt the Eurocentric lifestyle. So by support, we must be there for one another. Go back in the olden days. If there is a funeral, the ebusuapanyi, the family head, will call all the families. This and this and this has happened. What do we do? They share ideas. They all come. They all contribute and they support.
Yeah.
If there is a debt on a member of the family, the ebusuapanyi will lead. So in my class, when I'm teaching management of principles of management or management at the university, either at the undergraduate level or graduate level, I use practical examples such as this. This is the form of leadership management that we have within our own context. Knowledge brewed from an African context. And the ebusuapanyi embodies that level of let's support one another when there is a crisis. This is what we have been used to. And this is something gradually we are losing it. And I tell you, the fact that we have almost 90% treatment gap as far as mental health support is concerned, what it means is that if we begin to lose our touch on our African way of doing things, then we are in a dire future as a country, because we are losing our grip of the kind of social network, the safety net we have. At the same time as we embrace Eurocentric thinking, Eurocentric building, Eurocentric ideologies, we also don't have the hospital support systems. Then our mental health situation become worse. We don't have the support because we have 90% treatment gap. Where do we go? And that is where support is very important. So if you go through any challenging situation, please do not adopt the macho culture, especially men. Men have emotions. We also go through challenges. And often, as men, we show that the macho culture of bare men. So who told you? Please express your emotions. Talk about how you feel to that person you trust, or go to a professional and get that help. Do not suppress it, because if you keep suppressing it, the moment you open it, what do you hear? Best forth.
Yeah, it works.
And so we need to actually reach out for that particular help that we need. Let's get to those who matter, and then we can get the support from those who can help us reduce the levels of stresses and mental health challenges that we are facing. So I tell all HR managers, all managers of organizations, please, it is not wrong to demand the target from the employees, but also make sure you complement it by giving them the requisite support. And I want to say it on record. I have researched into media personnel and your mental health. And sadly, it is not the best. So I suggest to Z Media, I want you to set the pace by your leadership having a policy, not just medical insurance, but health insurance that also gives support as far as mental health care, psychosocial health care is concerned. Because truth be told, your job description open you up to many traumatic experiences. You go out there, first in news suggests that you'll be the first to witness it. You'll be the first to feel. You'll be the first to begin to reflect on this situation. And we are humans. We all need help.
Mr. Kweku Youngson, you had a good doctor. My mental health is very important. Let's move from the men. Now let's go to the women. Two very important things I want us to talk about in one breath. Maternal health and the effect it has on mental health. That's one. And then the issue of postpartum depression.
All right. So I mentioned stress as one of the most common mental health challenges. And it's obvious because day to day, we are moving left and right just for survival and what have you. The next common one you can talk about is depression. The third one is anxiety. So these three. So stress, depression, anxiety. Now, depression is very common simply because of a number of issues. If you look at the number line that I use, if majority of the people go through this traumatic experience, life-changing event, or something happens to them and they are not able to come back, recover quickly 2.0, then they are on course to depression most of the time. Now, by depression, a number of signs that we need to be alert for. I only use 2 or 3 practical scenarios so that whoever is listening to us this morning, you can also be a help. When I mention support, what it means is that even if you are an onlooker, you are an avenue for support to ensure that someone improve his or her mental health.
When you see something,
exactly,
say something.
Say something. And in the case of see something, say something, we have a way of doing it. And that is something that is also very important. So by depression, people now feel extremely sad. And the sadness is consistent over a prolonged period of time. It must be diagnosed by a practicing mental health professional. It could be a clinical psychologist. It could be a psychiatrist. It could be perhaps someone, a psychiatric nurse who is trained to even do that. Now, by depression, a number of signs can let you know that I am getting there. This person was bubbly. He comes to work. He's all over. Everybody, you know the practice steps of this person. All of a sudden, the person is withdrawing. Please, whoever is listening to us, if you know someone and you realize that this person is changing, this is not who he has been, please, the simplest thing we can do is everything okay? Can we talk? And begin to engage the person to find out how things are. It is the first sign all of us can notice. Even if you are not trained, do you see a difference between who this person was and the person I am seeing or I'm observing? Withdrawal symptoms. They want to be by themselves. They talk less now, and that is not who they were. It's inconsistent with that person we knew. Please, this person may be going through some challenges that potentially could be perhaps onset of depression. Now, aside this, there are some people who exhibit some sayings that suggest that perhaps they are on course. And that is why depression is seen as one of the leading causes of suicide. And that is another matter altogether, where almost every 40 seconds we have one person dying by suicide globally. And that is not a joke. And those who have depression are known to also, if they are unable to seek the help for treatment, as we are talking about, potentially could also lose their life through suicide. Now, if you are there and you hear someone singing particular songs, please let us take it to heart, reflect on it, and begin to render help. There are some people you often hear consistently for a period of time. The song you hear, Mete Mau Mau, and then you keep hearing this. The songs the person have been singing or playing in his car for a moment have changed its tone. Please, it's a wake-up call that we need to look at. In children of our days, especially younger adults and adolescents, what they put on their phone, so-called status, so-called Facebook wall, or social media wall, you can content analyze it over a period of time and realize this person is going through challenges. It could be even the emojis that they use. Some consistent emojis they use suggest that something is happening. That is about just generic aspects of depression. And obviously we have different forms of depression, bipolar and all that. But you mentioned about postpartum depression, about maternal mental health. Now, mothers go through a lot. I always explain the roles of mothers with about at least 4 or 5 balls. And they throw all of them in the air, making sure at every point in time one is in their palms. We salute all mothers who work so hard. And they deserve extraordinary support from children, from husbands, for those who are married, from family members, as much as we can. Now, postpartum depression. 6 out of 10 women who give birth globally go through postpartum depression. So if I'm a young man, I got married to Aso. Now Aso gives birth, and I keep screaming and shouting on Aso after a few days or weeks of birth. Aso, when Aso gave birth, now she's changed. She's not the woman I got married, and I don't understand. And harshly, that is my response to the changes I'm seeing. Please, let us check again. It could be possibly this woman experiencing postpartum depression, because the record says that 6 out of 10 globally develop postpartum depression. Some mothers, after giving birth, even feel like throwing their children away. And we have had a number of cases such as this. And this is an area I think we need to pay attention to.
Doc, you need to make a promise. I mean, clear your calendar for next week, because the conversation just started getting interesting. I would wish that we continue this. It's just a few minutes to the hour of 10. After the 10 o'clock news, NY the brand is coming up with the brighter side. Doc, before you leave, the mental health care system in Ghana, in one sentence, what are the developments or improvements you would like to see?
I must say we have come far. Mental Health Authority, Ghana Psychological Association, Ghana Psychiatric Association, all the NGOs, we have come far. But there is still room for improvement.
Thank you very much. There's still room for improvement. This has been Health and Wellness Tuesday. We've had Dr. Collins Badu Agyemang, who is the president of the Ghana Psychological Association. We're talking about mental health. We never even scratched the surface, I can tell you.